name is Jill Feldman, and I'm a lung cancer patient and advocate. And at this year's conference, I have a poster that talks about changing the lexicon in how we talk about lung cancer research. And what we really, the problem that we saw was that the language used when talking about research and science was really technical and very overwhelming for patients and families to understand. So my colleagues and I actually got together with a pharmaceutical company and discussed the problem. And the company was very receptive to changing the lexicon in how they talk about research, both internally and externally. And the idea was not to change how researchers talk to each other about it, not to change how doctors talk about research, and really not at all to compromise the integrity of research, rather to empower patients and families to be a part of the conversation and to better understand the research that many of us are reading now, whether it's coming, reading in an article or coming to a conference like this. And so there was a development process that took place, and the first thing was establishing the needs. So, doing social media searches and looking through journals and really establishing that need for patient-friendly, language used to describe the research. And then it was gathering insights. So there were some focus groups that were done. And last year at ESMO, we put together an ad board of oncology professionals and patient advocates, a global ad board, and really had a discussion understanding both sides, that the oncologists felt they had a really difficult time explaining it in a way that patients could understand, and patients who want the information from their oncologist found that it was really difficult to understand. And I just want to note too that there are some fantastic resources online, but they are not patient-friendly resources, and they are not easy for patients and families to understand, especially when people are newly diagnosed. And why is that difficult? I think it's hard to understand unless you've lived it. But when you're diagnosed with cancer, it's like you are suddenly drop-kicked into a foreign country. You don't know where you are, you don't speak the language, you don't know the culture, the terrain is unfamiliar, you don't have a map, yet you need to figure out how to survive with a mountain lion chasing you as you are navigating a fragmented healthcare system, simultaneously confronted with making difficult treatment decisions, knowing there's no room for error, but struggling with whether the potential benefits will outweigh the potential risk factors and the impact it will have on you and your family. And this is all happening at a time when anxiety and distress cloud your ability to comprehend things clearly. Now that was a lot, so imagine how that feels for patients. And so after, we kind of did that, the initial ad board and some other focus groups, there was an initial lexicon that was developed, and that went through another iteration process with talking to the people, seeing if, what came out of the ad board was what we were trying to address. And so we went through another iteration of it, and the final lexicon actually includes 19 words or phrases categorized under safety, efficacy, and then there are other relevant areas. And just to give a few examples is, when you use the word median overall survival, patients have no idea what that means. I like to say that's not even really something that's important to patients, but it's used. So if it's used, let's describe it in a way that patients would understand, meaning you saying over half of the patients, using words like that or using, landmarks like that to really help the patients understand. Also, there are terms like genetic mutations. Using the word genetic mutation actually has, almost a stigma to it. So another example is using the words or the term side effects instead of adverse event, because an adverse event means absolutely nothing to patients. Now, the way we really kind of tried to organize it was looking at high complexity words or terms versus low complexity words or terms. With the high complexity words or terms, it's, the idea is, of course, when you are at scientific conferences or submitting abstracts, then you use the scientific term. When you use the low complexity terms or the patient friendly terms in low complexity situations, it's like plain language summaries or different platforms or setting where you are really talking to patients and families or the general public. And so the goal is really to foster this inclusive language, patient friendly language into the company at all levels and use it externally as well. And so I think that the idea is to empower patients to understand the language, to be active participants. And so the hope is that this will actually encourage others to do the same within their companies, within their institutions, and really think about what we're saying and how we're saying it and the impact that it has on patients and families. And I always like to say that just like research and treatments have advanced, the language that we use needs to advance to be more inclusive, to empower patients, and also to be more compassionate and non-judgmental. So I really appreciate the efforts from this company to understand what the patient community needs and to actually take the actions to address it by working on this lexicon.